Hello and welcome to Pet Alert. I'm Dr. Alicia and today we'll discuss obesity in cats. Before we start, please consider subscribing to the channel and hit the notification bell as well. That way, you will be notified as soon as we release a new video that will help you become a better pet owner. Nowadays, the most common form of civilization diseases in pets, as well as in humans, is the overconsumption of calories leading to obesity. Approximately 30 to 35% of the general feline population is obese, with 50% of cats aged 5 to 11 years old weighing in more than their ideal weight. Obese cats are those that are at least 20% heavier than the optimal weight due to excessive fat accumulation. What are the risks of obesity? Obesity shortens a cat's lifespan and increases the likelihood of developing a disease. It's important to keep your cat fit throughout his life. Obese cats develop an increased risk for many types of cancer, diabetes, heart disease, and hypertension, osteoarthritis, and a faster degeneration of affected joints, urinary bladder stones, bleeding problems, especially in flat-faced breeds such as Persians, anesthetic complications during a potential surgery as they are less heat tolerant. Obese cats who stop eating are at great risk for developing a potentially life-threatening condition called hepatic lipidosis, a devastating liver disease. Other possible complications of obesity in cats include skin problems and difficulty fighting infectious disease. How can I tell if my cat is obese? Body weight can be used to assess whether or not a cat has gained or lost weight. However, dictating a weight which is ideal depends on the age and breed of the cat. Therefore, the easiest way to tell if your cat is carrying too much weight is to assess their shape. It may help to use this cat obesity chart. Most veterinary practices use a body condition scoring system, also known as BCS, on a scale of 1 to 5, where a BCS of 1 is very thin, 3 is ideal, and 5 is obese. Rib coverage is not only an important measurement to help you identify if your cat is overweight, but it's also easy for you to do at home on your own. This is Naki, and now I'm going to show you how I calmly check his body condition without him even being aware that anything special is going on. First of all, I'm going to make a visual assessment. So we are looking at Naki's outline. We can see that the line of his tummy tucks upwards. This is a very important part of the inspection, as many cats accumulate fat in the fat pad on the belly. We'll very gently put Naki on his back and show you the fat pad. Going back to our side view, we can see that Naki narrows in at his waist. It's easier though to see this from above. Naki is a hairless cat, also known as Sphinx cat, so all of this is easy to see. If your cat has long hair, you might need to confirm what you think you see by using your hands to identify the waist and tummy tuck. Next, I'm going to feel along Naki's back. I can just feel his spine and nothing more. I don't have to try too hard to find it all. I can feel that it's reasonably covered and can just feel some of the bumps of the bones of the spine. And now I'm just going to feel over the ribs. I do this by gently probing the area and running my hand over the rib cage. I can feel individual ribs with a slight fat covering. I can't see them, but I'm not struggling to find the ribs by touch. That's our inspection complete. It really is that simple. Why is my cat obese? First, diet and exercise. Most obese cats are simply just eating too much. Eat less, move more. This simple formula really does work. Second, medical. It's rare for obesity in cats to be caused by medical problems. However, if your cat has slowed down due to an illness such as heart disease, lung disease, or arthritis, they may have a tendency to gain weight. Always have your cat checked if you think they might be gaining weight because of medical condition. Another one, pregnancy. If you have an unnurtured female cat that could have had access to a male, it's important to rule out pregnancy as cause of their weight gain. What is the best diet for an obese cat? It's important to feed your cat a healthy diet and a sensible amount of treats. Usually, you will find the recommended daily allowance for your feline friend on the back of the food packaging. It's important to feed them the amount recommended for their ideal weight, not their actual weight. If your cat is overweight or does very little exercise, you will need to adjust their food accordingly. Don't panic if you have accidentally been overfeeding your cat. Just reduce their meal size slowly over a couple of weeks. Ideally, your cat should graze throughout the day, split their daily allowance into at least 2 meals, ideally more. If you have an overweight cat that doesn't go outside, it's likely that they are taking in more calories than they burn of each day. They will benefit from a low-calorie diet. How do you feed 2 cats when one is overweight? Fortunately, if your cats are microchipped, there's a simple solution to this common problem. It's now possible to purchase microchip-activated feeding bowls that only open for one particular cat. By using these special feeding bowls, you can easily regulate how much food each of your cats has. Alternatively, you could feed your cats in separate rooms to prevent them stealing food from each other. If your small cat needs to be fed throughout the day, it may be necessary to feed them separately by hand. Exercise. Make sure your cat has enough daily exercise, especially if they are kept indoors. If your cat is naturally quite inactive, you will need to encourage them to move around by playing with them using various toys. Keeping your cat fit will give him the best chance of living a long, happy life. If you think your cat is obese, or if you are struggling to keep your cat slim, contact your vet for advice. That's it for this episode. Thank you for watching and I will see you soon. Bye bye!